everyone, this is Dr. Erdogan by Smile Hair Clinic.
Hello, I'm Dr. Bilgin from Smile Hair Clinic.
Hello dear patients and our followers. I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic.
I will inform you about the operational facts and the result you will see within time. So let's start with his raw photos first. He has experiencing hair loss for 2 years. He used finasteride and minoxidil for some time, but he didn't see some improvement. So that's why he came to us for transplantation. Once we are looking for his scalp photos, that he has a receding hairline. His temporal areas were very receded back. Also the frontal hairs are very thin, the mid hairs and the crown hairs as well. Overall, he has a very thin hair in the donor area also. So we tried to get the maximum grafting with him because he needed the maximum session. But at least even we take 6,700 grafts with him. Because of very thin hair, we see mostly with more blonder or more Nordic people from Europe, we see more thin hair. So we try to get the maximum grafting. Okay, this is the final operation end result. So as you see, the fronts are more intense and more dense actually, both temporal part, including the frontal part. Then we decrease the density to cover more areas in the middle and in the back. Sometimes, yes, sometimes even we have 3,000, 4,000 grafts and we have better coverages. Sometimes with this number, with higher number, we have less coverage. It all depends on the structure and the caliber of the hair. Sometimes they are very thin, sometimes they are very thick. The number is not important. The important thing is what multiple ratio, or if it's thin or thick, these are affecting the results actually with us. We have as a 12th mount photo I'm showing you. Again from front, very nicely growing hair. From back, yes, still crown may need another operation, but we leave it, we talk with the patient. But front and mid scalp is perfectly healed. This is his donor area from the back. It looks like it is very nice. And from side, that looks very perfect.
Today we have a female hair transplantation case, evaluation of the case and the results of the surgery. There is a very big misconception thinking that the hair restoration surgery or hair transplant surgery is mostly used for the men. Yes, and most of the procedures we perform are done on men patients, but there is a very big group of the patients in females as well. Our patient is a 34-year-old female patient with a unique type of the hair loss. It's a traction alopecia. Traction alopecia is widely seen across the female patients. Traction alopecia happens when a very tight hair stylings like ponytails, dreadlocks are used in females. It causes traction of the hair root and its blood supply is compromised, and all the time the hair becomes thinner, thinner, thinner. And there is a very unique pattern. You can see the shade of the hairline. It's not completely gone, but it's almost empty. There are some like baby-like hairs. And as you can see here, we preserved the front hairline of the patient herself. We didn't change it, we just reinforced it, reconstructed it, marked the areas that needed to be transplanted. And one of the important features here, we also marked the direction of the hair, how they grow and how they're distributed. Now, we can see a 1-year result of the patient. The donor area has completely healed, recovered. The sides at the areas where the transplantation is done, you can see the grafts are growing in the correct direction. So even though when she makes the hair stylings, make a ponytail or push the hair to the back, you can see the hair start with some unique thinning we see in most of the females and in men patients as well, and goes started thickening to the back of the head. So the restoration of the front hairline or revision of the front hairline is done, the adjustment of the density is done, the patient is happy, and it's really good result. We can see it from the front hairline that the frame of the face is also restored and the thin and receded hairline is completely rebuilt.
Today we will check our patient's Victor's photos and file. We performed him a DHI hair transplant. So if we check his photos before the operation, you can clearly see that He needs hair transplant for the whole head. He lost his hairline. He needs to be fixed hairline and the first half of the frontal head. And also after a tiny part in the middle of the head, he also lost significant density in the crown. We performed DHI hair transplant as our patients wished. And I want to clear one thing, both FUE and DHI has their own pros and cons, so they are not superior to each other. Please always keep this in mind. What we extracted from his donor zone is 4,900 grafts. Some may say that it's a lot, and if you transplant this much, that many grafts on the scalp, they will not grow. When we reach the 12-month mark, hairline is dense and nice. His donor zone looks nice, crown looks nice. He looks like a new person totally. He looks very different. You can see how his look changed, and he is really younger, 10 years.
I would like to share a patient's case to explain what we did for him. So I'm starting very quickly to his file. His name is Victor. We did his operation in 2022, July. The operation ended up with 5,000 grafts in total. So he had never usage of a medication. We started directly with the hair transplantation. So I would like to show you the photos first. This is his frontal part. You see that in the central part there are some thin hairs. In the both temporal part it is receded already. It's totally bald. Once we see from top, you can see that the frontal part is thin until the mid-scalp, and in the mid-scalp also it is very thin. It's not very well desired density. And this is his crown. Crown area seems huge, and also some thin hairs and some bald areas also. So he need probably over 6,000-7,000 grafts. Let's see his 12-month results. This is from front. It's very thick, good. From top, just I think in the central part of the crown still could be another session done for that part, but I think it's very, very thick and covered.
Today we are going to do a small brief evaluation who underwent the hair transplantation surgery in our clinic almost 14 months ago. So the patient had a mixed type of the hair loss. It means the front line is mostly close to the neurotype 2 to the 3, and the crown area is close to neurotype 4V. V means the vertex of the crown area. As you can see from the pictures, he is now neurotype 2 to neurotype 3 means the receding of the front hairline and asymmetric hair loss of the temples, losing of the density and the volume in the front forelock, and maybe some degree of the hair loss in the front third of the hair. And in the crown area, we have the crown area that is in size of 45 centimeter squares with areas of hair loss and miniaturization of the hair. The patient was transplanted in total 3,900 grafts. The hairline looks really major with the sharps and with more acute angles that are mostly seen in the male type or masculine type of the hairline. Also, the corner is one of the pitfalls that most of we see during the hair transplantation surgery, the transition from the front side to the temple, or as we call the frontotemporal transition or frontotemporal angle. It has been adjusted really nice, so it's really hard to say whether the patient had the surgery or not. So the good surgery is an unnoticeable surgery. And also we can see the crown area. It has been covered. There are almost no visible empty spots. So it's a good example on how the hair transplantation surgery can dramatically change the life quality of the patient, his or her outlook. Also, we advise the patient to stick up with the medical treatment. It can be finasteride, minoxidil, or combination of both of them.
Today we are going to check our patient Christian's journey of his hair transplant. So, if we look the pre-op pictures, we can see that he has a large forehead. His main concern was to cover the forehead. So we drew a hairline at the end of his facial muscles, As you can see in these pictures, we lowered the hairline like 4 centimeters. Now we have the 12th month photos. If you see these photos, they are pretty good. His donor zone is completely healed. His crown is fully covered. You can see from the back, it looks really nice. And the style of his hair in the front is pretty sharp. He made, I guess he used spray. He made a really nice styling for the front, and it looks pretty well.